Hi, I'm Dr. Kivett from Santa Rosa, California. I'm board certified in plastic surgery and dermatology, and I have extensive experience with hand work in that the hand surgery fellowship helped, and I had two teachers in there. One was orthopedic, the other were plastic surgeon, and they focused their practice solely on hand surgery. And I'd like to speak today about finger and hand amputations. It's a tough subject to talk about. We don't have to talk much about it. It's not taking place as much as it has in the past, but there are times when things happen. Uh, Probably the most common of the problems is when the tip of the finger gets amputated, meaning just the soft tissue, not the nail. There are other levels as you go further up, then the nail in part gets cut off, or even part of the tip of the finger bone. And surprisingly, with conservative treatment in many of those cases, uh, the volume restoration naturally takes place as long as the wound is kept in a good condition with respect to moisturization and lack of infection. Of course, as you'd expect, smokers don't do as well as those who have good blood flow to their skin in their finger. Um, and when you look at the other factors of concern in terms of pain afterwards, as a person's healing, putting the hand into a freezer to get out a piece of frozen food, or sensitivity when touching a piano key, or chronic pain from the area, these are much less if conservative treatment is used on fingertip amputations. Um, there are a number of other tissues that can be brought into the area, either from further down on the finger itself, can be slid up to the end, or tissue can be pulled from a finger next to it and temporarily borrowed to cover that defect. So there's lots of options on what's called the reconstructive ladder. The reconstructive ladder is the range of treatments that are stepwise treatments that go from the conservative treatment that I mentioned to moving tissue up, to moving tissue from another place on the body, to moving the hand to another place on the body to cover that wound, to taking tissue completely from another part of the body with blood vessels attached and sewing it onto that area, to even taking tissue from another human being, whether it's skin grafts or whether it's a much bigger tissue from someone who has either recently passed away or someone who's still technically alive but has been determined to be brain dead. The important thing in the finger amputations, hand amputations, is that the goal is to preserve function, especially with respect to length. The more length, the better, so that the tendons that are moving across these pillars back and forth will have better strength in them. Because after all, function is the most important aspect of hand, other than appearance and other issues. It's function that really is important here. It's important in preserving the function to also remove obstructions. So digits that clearly, in some cases, can't be recovered based on severity and numbers of operations, severity of injury, cost of the procedure, time spent, failure of prior operations, chronic pain, work loss that's no longer tolerated, those patients can have amputations. I think of a case that I had a while back where a person was cleaning a gun and actually put a hole right through the palm of his hand. And in shooting the hole right through the palm, the nerves that came through the wrist canal here and into the area, those nerves were gone. So the rest of this finger here was numb. The blood flow was not good. The finger was, in all likelihood, going to be stiff because the tendons were gone, both from this side that do this and from this side that do that. And so we spoke, and he decided that a ray amputation was the best. So we removed simply all of this tissue all the way down to here, including the finger, and then he ended up with basically a three finger, one thumb hand that worked just fine for him. And if you watch a cartoon, Mickey Mouse has 3 fingers and a thumb. And so that got him back to work quickly. He moved ahead with his life and avoided a number of problems. There are certain situations also where hands need to be amputated. For example, you've probably heard of these different kinds of infections called Rocky Mountain spotted fever or severe drug reactions, wherein all of the blood vessels into and out of the hand and the feet are completely coagulated off, and so the entire hand will die. And so dead tissue does not resurrect suddenly like Lazarus coming back from the dead. And in fact, that tissue is what gets infected and can put the person into infection in their bloodstream, causing shock, which we call septic shock from sepsis. And so it's a life saving measure to go ahead and remove those dead limbs. The occupational therapists play a part here, certainly, in that they need to keep the rest of the hand moving. So if there are certain parts that need to be removed, then the patient can be trained to move the other parts of the hand that still do remain working, and in fact, some new tricks with the remaining hand that the patient had not envisioned before can be brought into play. So if you know someone who has a problem like this, or if you simply want to share it with friends, family, neighbors, please do. If you have comments or questions, please feel free to leave them. Give us a thumbs up. And as always, if you can subscribe to our channel, this will help us provide more educational information to people. Thanks for listening.